Welcome back, everybody. We are now heading into our last presentation of the conference. This one's going to be really interesting and is also going to involve breakout rooms as well. So looking forward to that. This one is from University of Warwick Medical School, Dr. Imogen Davies, Dr. Catherine Bennett, and Dr. Unwin on challenging racism in active anti-racism faculty development. So without further ado, I can pass over and take it away.
Thank you very much. Thank you. So good morning, everyone. Thank you very much for inviting us to come and speak at your conference. We hope it's been interesting for you, and we're really honoured and privileged to come and talk to you about this. So our session is called Challenging Racism, Active Anti-Racism Faculty Development. It is a bit of a tongue twister, isn't it, actually? We say active because we want you to leave with a resolve to be actively involved in making life better for people of Black, Asian and minority ethnic heritage. Now, we know that the acronym BAME is a bit contentious. We're only using it in a few limited situations during this session that we're doing, and we're using it to help us to describe data sets and not to describe individuals. But maybe if you have questions about that, we can pick that up in the question and answer at the end. So we obviously come from medical school. We are especially interested in improving our experiences for our medical students. And we know that not all of you are going to be working in higher education, but we do think that most of what we are going to say is going to be absolutely applicable to wherever you happen to be working. So I'm going to start by introducing myself and letting the other two people in our team introduce themselves as well. So my name is Imogen Davies. I'm a senior teaching fellow in faculty development at the medical school. So I work with the MBChB faculty and also on the Masters in Medical Education. Catherine, do you want to say hello?
Thanks, Imogen. Hi, everyone. I'm Catherine Bennett. I lead faculty development for the MBChB course at Warwick, and I'm also course director for our Masters in Medical Education programme.
And Emily?
Thanks, Imogen. So hello, everyone. I'm Emily Unwin. Like Catherine and Imogen, I'm part of the faculty development team at Warwick Medical School, where I also teach on the medical, the Masters of Medical Education.
The whole of faculty development is a tongue twister. So what are we going to be doing? So just an overview. The aims for this session are we're going to describe some contemporary effects of racism in higher education medicine. We're going to explore a scenario of responding to racism. We're going to discuss opportunities for active anti-racism in your own practice and your institution. And so how are we going to do that? We've got some information, first of all, on some slides that we're going to talk through. We're going to show a film, and then as a consequence of that, we're going to get you into breakout rooms for a bit of a discussion. And then we've got 2 Padlets. So a breakout room with a Padlet for you to post on, and we'll give you some instructions about that when we get there. And then the summary and then the Q&A. And we've got another Padlet for you to do that with as well. So our whole session today is actually based on our 2-hour workshop that we run for our MBChB faculty, in which we talk about race, racism, and how to respond to race and racism in practice. And we do that in quite some depth. So we've drawn on some of those workshop slides that we have, and we're also going to talk a bit about the workshop as well, so you kind of get a bit of an experience, but also a bit of a commentary about why this is important. We also know that we could honestly talk about this all day, and we also know that it's too big for us to cover everything that we would like to say to you in the time that we've got, but we're going to do our best. All right, so the other thing that we would like to point out at this point is if you have any questions, just post them in the chat and we will try and pick them up in the Q&A at the end. So just the final setting up thing, participating in our workshop. Please keep your cameras on during the discussions, and we quite understand if you want to switch them off when we're just doing the talking bits. Please check that your microphones are muted when you're not speaking. You've probably had these instructions over and over in the past 2 days. You've probably heard of teaching spaces maybe as being a safe space, but we prefer to think of this maybe as a bit of a brave space considering the subject matter that we're talking about. So we're hoping that everyone will interact with respect, kindness, and the starting assumption of goodwill, that you're here to be interested in this and learn about it. We also ask that you talk openly, please, about everything that we've discussed and shared, but don't attribute this to any individual people outside of us facilitators. Okay. We're not going to ask you to share personal experiences, but our experience of talking about this is that sometimes people do. So that's also why we ask you not to attribute any comments to individuals. So the discussions are going to be about the film that we're going to show and about questions that we pose to you, which aren't about your own personal experiences. Okay, so I'm going to hand over to Catherine, who's going to get going.
Thanks very much, Imogen. So just to contextualise this a little bit in terms of race and racism, and I know you've talked around these topics a lot already. So just as I was saying, so just to contextualise a little bit, when we do these workshops, we talk quite a lot about race and racism at the beginning. We're going to do a very abbreviated little bit today. So race is socially constructed. I'm not going to say a lot more about that, but we know that race and racism has a big impact on our students' experiences, and this is well reported in the literature. But the paper we like to start with is this one by Nariel Morrison, who's actually one of our former students from Warwick. So she did a research project during her time on the course, looking at what are the experiences of Black, Asian and Black, Asian and ethnic minority students on a graduate entry medical course. So she did interviews with 24 students, pulled out a number of themes of importance around relationship, around belonging, around the daily struggles that they'd faced. And we just wanted to highlight some of the things that the students said. So here are a few quotes. Last year, a patient said, "I passed for white. I constantly feel like I don't deserve to be here. My name is not even hard, but no one can get it, and I feel no one makes the effort to get it. There are certain things I've faced in my life which other ethnic minorities would understand, but those who are not an ethnic minority wouldn't really get." So those are comments from students that are studying with us, and clearly things are going wrong, and this was part of the reason why we wanted to put these workshops into action. Just thinking about racism for a moment, and thinking through the different forms that we might see or people might experience. So the first two are individual. So if you start at the centre with internalised racism, so our own prejudices, our own unconscious biases, and then interpersonal is what we often think of when we think about racism. So how that acts out, what people do, how they express that. But then, of course, it's much wider than that. So institutional racism, where policies and practices are racist, it's illegal. But of course, we still have unintended, or I hope it's unintended, racism in action. So structural racism, where there are unintended consequences from policies and practices that we think are okay, but we just don't think clearly enough about it, and actually there is racism in action there. And then systemic racism, where this interacts across our different organisations, culture and systems. And there's a questionnaire that asks you to think about what the impact of racism might be, and I'm just going to talk about a few of the questions. So I can be sure that the gatekeepers in my life, such as my boss, my local MP, my landlord, are the same colour or race as me. I can be sure that my children will be taught a curriculum which testifies to the existence of their race. I can go to a museum or art gallery and will see people of my race widely represented in these objects and artworks. I can choose makeup or bandages in flesh colours and have them more or less match my skin. And then there is an attainment or awarding gap in higher education, and we're going to talk a little bit more about that in a few minutes. And we just wanted to say a little bit about microaggressions, so defined as brief and commonplace daily verbal, behavioural and environmental indignities, whether intentional or unintentional. And I think it's important here that the intentionality is not what's relevant. So it might be intended, but it might be completely unintended, but it's the repeated and the cumulative effect that those experiences have and the impact on the individual. So, going to hand over to Emily to say a little bit more about the awarding gap.
Thank you, Catherine. So I'm going to present a contemporary example of systemic racism, which is known as the awarding gap, but was previously called the attainment gap. So you might have heard it called that as well. So what is the awarding gap? Well, in higher education, the awarding gap is the difference in proportion of students who identify from a white background compared to students who identify from a BAME background, achieving a first or second class upper honours degree. Now, an awarding gap exists across nearly all higher education institutions in the UK, and the average size of the gap is about 12.6 across all institutions. Now, at Warwick Medical School, like many medical schools, there isn't a degree classification, it's a pass or fail degree. However, we do award merits, distinctions and honours. And that's where our awarding gap is seen. So at WMS, the awarding gap is the difference in the proportion between students who identify from a white background compared to students who identify from a BAME background, achieving merits, distinctions and honours. Now, I mentioned that on average, the size of the gap is about 12.6%, but at Warwick, we're really pleased to say that our gap has fallen slightly to 9.45% in last academic year. And that's partly due to some of the initiatives that we've put in place to try and address this gap, which we'll discuss a bit more later. So if I just bring your attention to this graph now, so what we're looking at here are all higher education institutions across the UK, so not just medical schools, but all sorts of degrees. And what this graph is showing is that on the vertical axis, it's showing us the proportion of students who are achieving a 2-1 or a first class degree upon completion of their degree. And on the horizontal axis, we've got their entry qualifications, what they entered that higher education institution with. And then the lines represent the different ethnic backgrounds. And what you should be able to see, sort of visual snapshot showing you there, is that our students from a white background have more likely have a higher proportion of those are achieving a 2-1 or a first class degree compared to other ethnicities. And if we really focus on our high achieving students, so those who are coming into university with 4 A's, we can see that we've got about 90% of our students who identify as coming from a white background who are leaving those institutions with their 2-1 or a first class degree. And if you compare that with our students who identify as Black, once again, who enter that institution with 4 A's, just over 80% of those students are leaving with a 2-1 or a first class degree. And you'll see that that gap remains across the different, the spectrum of entry qualifications. So it really does affect all students, no matter what they're studying or where they're studying. Now, just to remind you that the medical course at WMS is a postgraduate degree, and to gain entry onto our course, our students have already achieved a 2-1 or a first class degree, and yet we continue to see an awarding gap. So you can see that it follows, that awarding gap follows our students throughout their learning and educational journey. If we go back to just focusing on WMS and our MBChB course, that's our medical course, and we're going to look at some cohort data over the last 10 years. So this table here shows you in the first row the number of students who passed our medical degree over those 10 years, and we've divided that by their by different types of ethnicities, different ethnic backgrounds. The second row shows of those who passed, the number who achieved honours, and once again, that's been categorised by ethnic background. And the final row is showing the proportion. And what should really jump out here is that we can see that students who identify as coming from a white background, the proportion of those getting and being awarded a high an honour degree is higher than the majority of the other ethnic backgrounds, the Asian, Black, Chinese and other. So we then grouped the Asian, Black, Mixed and Chinese and others to work out the difference, try and work out our awarding gap. So overall, students from a BAME background, just over 8% of those were awarded honours. And so when we take that away from the 17% or just over 17% of students from a white background, you can see how we got to our awarding gap of 9 and nearly 0.5%. So what are we doing about this at WMS? Well, we've recognised that it's a problem and it's definitely something that we want to address. And so we've put several initiatives into place, which I'll go on to explain to you. And I've divided this by students and staff. So let's start with looking at what we're doing for our students. So our students are expected to engage with longitudinal modules throughout the course on racism and on how to be anti-racist. They're also expected to attend mandatory bystander training. There's a peer mentoring scheme whereby students can support each other throughout the course. We also have a BAME student network where once again the students support each other, and the students can also join the awarding gap group, the working group, which is working towards how we can address this awarding gap. In terms of staff, what we're doing for our staff, well, there's a challenging racism workshops, which we ask that all teaching staff are involved with, and we'll be talking a little bit more about those in a moment. And we also have staff involved in our awarding gap group, and we make sure that that group contains staff members from key areas across the MBChB course, so from admissions, assessments, curriculum development, students, as I mentioned, and faculty development. And then of course, there's a university-wide staff training in anti-racism. We also are participating, Warwick University as a whole is participating in the Say My Name project. If you've not come across this before, then this is a project whereby we're encouraging all students and staff to include an audio recording of their name on their email signature. And we also encourage our students and staff to listen to those audio recordings when they receive emails. And the aim of this project is partly to, as we saw in that earlier paper, the Nariel's paper, students saying that their names aren't being pronounced correctly, and let's try to overcome that. So try to overcome some of those barriers that our students experience in the learning environment due to their names not being said correctly. I'm going to hand you back over to Catherine, who's going to tell us a bit more about the challenging racism workshops we've been doing.
Thanks, Emily. So our workshops are designed to challenge racism and to encourage people to be active anti-racist. That makes them quite challenging to run, and we have a system for training facilitators to do that. As Imogen said at the beginning, when we do these workshops, we provide a lot more detail about racism, and we have more time for discussion. We applied for some money to make some films so that we could use those in the workshops. So we chose 3 films out of a set of 5. They were professionally made for us, but they were based on our own student experience. So we paid a film production company to work with our students to design scenarios and then film them. And we're going to show you one of those a little bit later on. So just to talk you through the films, the first one is called Oh, Were You Born Here Then? And this is where we meet Omnira, who you can see here. We also meet Katie, who we can't see. And in their dialogue, we learn about the importance of names. Involved in that discussion is also Anthony, the educator, who we see come in, walk into this issue and not really quite know what to do. Second film, 3 out of 4 isn't bad. Again, we meet Omnira and Katie. They're in a tutorial in a clinical setting, and Anthony is their lecturer. And he is talking to Katie and asking lots of questions to Katie. Omnira, you can see her with a hand up there, quite desperate to get in, answer a question. In fact, she even tries, and Anthony pretty much ignores her. So Omnira is sidelined in that tutorial, and we think about the effect on Omnira and her learning and what's been going on there. In the next one, we start in the same way. But you can see from the sepia tinted pictures, we hear here Omnira imagining speaking up, voicing her own perspective, but also imagining what will happen if she does. So that's quite an interesting film to see her perspective played out in her mind, how she might have wanted to say some things and what she's afraid might happen if she does. Film 3, where are you getting your information from? So here again, we've got Omnira and Katie, this time joined by Baramji, and you can see Anthony, the educator, and they're in a Zoom tutorial. And as part of their teaching, a slide is shown of a black man with TB. And it's Baramji who speaks out and said that this is a racial stereotype. And there's then discussion in the class about that. In a moment, we're going to show you film 4. I never imagined people would get so sensitive. So we're actually going to meet Anthony. So this film is from Anthony's perspective and how difficult the situation feels for him. The film is just under 4 minutes long. And after we've seen the film, we're going to go into the breakout rooms. So you will have seen the conversation that Anthony has with a colleague struggling with racism in his own setting and how to deal with it. And so you'll have an opportunity to reflect together on Anthony's struggles. And then we'd like you to talk about what is your experience of active anti-racism activities in your own institutions. And we have a Padlet, the QR code is there and the link is going to be posted into the chat. So we're going to see the film first. I never imagined people would get so sensitive. So at this point, we need to stop the recording because the ethical approvals that we needed to make the films based on our students' experience mean that we can only show them in facilitated anti-racist sessions. So we can't make the recordings available.
Okay, so welcome back, everyone. Welcome back. I'm just going to, if I can get my cursor, I'm just going to pull up the Padlet so that you can see what everyone has been writing. If you were the first one in, you might not have seen what came after you. So this is quite an interesting set of comments. There's an awful lot of mandatory training on anti-racism. And then some comments about maybe the quality of that mandatory training. So can often be quite passive, watching videos, and then non-mandatory training, which of course will only pick up people who are motivated to go and do it. And some of the other issues that we often find that the people in charge of anti-racism maybe just move jobs or aren't allocated sufficient time or resources, or it's run by students who are often keen, but obviously they're students, and so their role is to get their degrees, and especially if the students who are running that training happen to come from a Black or an Asian or minority ethnic background and are already possibly at risk of suffering from getting a lower class degree than their white peers, then the worst thing you can do is to add in extra work to make them try and solve the problem that they are the victim of. So yes, we can see that there's maybe a fair amount of work that's been going on, but maybe not coordinated, no sort of central coordination that everyone can know exactly where they're going to. The idea of cultural awareness has come up as well, and we were actually having a bit of a debate ourselves in the main room about how far awareness of cultural events can be called actual anti-racism. So clearly it's important to be aware of cultural events, but I think anti-racism, being actively anti-racist, takes more effort than being aware of what those cultural events are. So it's a really important step. It's a really important part of it, but there is more, there's definitely more to it than that. Right, microaggressions training, fantastic. You also Susan Cousins in Cardiff Uni. Okay, fantastic. And bystander training being run by the police. So again, there's maybe there could be a bit more sensitivity to the topic and to who's attending and who's involved in that. So I think we're really pleased to see that there is anti-racism work going on, and that you have come up with quite a lot of comments. It did cross our minds that maybe no one was doing anything. So we're pleased to see that that's working. So we are also aware that our time is limited to go further into this. But we wanted to start that conversation about what was already out there. And we know that we've given you quite a bit of information today, and maybe our film might have prompted some thoughts about that. So our final kind of summary is to ask you, what do you think you could actually do? Do you think that you could feel empowered after this, maybe knowing a bit more of the background, knowing a bit more of some of the issues? Do you feel empowered to actually go back to your institutions and ask them to do something, or to commit to doing something yourself? So our final question, Catherine, I don't know if you've got the slide, or shall I pull up the slide? I'll pull up the slide if I can find it. Oh, brilliant. Right, what anti-racism activities could you do, or could you ask your institution to do? So we have another Padlet that we're going to give you just a minute to have a quick think about and type something in that this session might have hopefully prompted you to have thought about, or maybe some of those issues that you've already seen about maybe the sort of lack of centralisation and lack of continuity might prompt you to think about how that could help. Okay, so we're up to 12:25. So what have we got? External trainers with lived experiences. Say my name, that struck home with someone. Face-to-face training. Right, and feedback to my institution. So anti-racism training, which maybe wasn't particularly good quality. And so now you've got some confidence to go back with some of the ideas here, particularly using video to discuss issues rather than personal experiences of staff. Oh my goodness, yes. So if you want to, there is literature about not re-traumatizing people who've already been traumatized by an experience of racism, and making them be re-traumatized for the services of education. So there's literature about that says that that's not really a very good way to go. Okay, so a lot of suggestions coming through. And also there's a comment about mandatory training on anti-racism, sexism and ethnicity, and we definitely are aware that there is an intersection between what we've been talking about and other protected characteristics. That always comes up, that there are skills and strategies for dealing with racism that are applicable in other situations as well. Okay, so thank you very much for filling in that Padlet. Thank you, Emily, for sharing that. So we are at the end of what we wanted to talk about and lead you through. So I think if we move to Q&A, are there any questions or comments that anyone wanted to raise with us? We've got some time to discuss now in a bit more free way than on a Padlet.
There's some good comments coming in about taking the ideas that people have posted on the Padlet.
Yes.
Which is great.
There's someone's mentioned active conversations that they do in Cardiff University. Would you like to say a bit more about what an active conversation is? I think there was you posted a comment about Cardiff.
I can, because I'm from Cardiff University.
Brilliant.
So the library's ED&I group didn't want to do kind of more training that people just could choose to attend or not attend. We came up with the idea of doing what we term guided conversations. So we come up with a topic that we want to be discussed. We've done microaggressions has been one of them, but we've done gender neutral language and hidden disabilities. And the ED&I group comes up with the kind of background and the prompt questions. And they start at the senior management team who hold the guided conversations, and then they facilitate those down, so they run a guided conversation with their people they line manage, those people run a guided conversation with the people they line manage, and so on until all the library service has been covered. And the idea is that people feel more comfortable having these conversations with their small group of their peers that they work with regularly, and so will feel more comfortable talking as a small group and expressing their ideas and thoughts about the kind of topics and issues that come up. And we ask for no feedback from the sessions. The conversation is entirely what that group wants to talk about within the kind of premise of the topic that we've given. The only feedback we ask for is that they were completed, the session was completed.
Wow, that sounds a really effective way of doing it, because of course there are issues around the confidentiality of the space and the safeness of the space when you're discussing something that's so tricky.
Imogen, there's a question. Have we experienced any resistance from staff or students?
Do you want to answer that, Catherine?
So doing the workshops is always interesting, and you do get a range of views. I would say I've only met a small amount of resistance, but of course there's a certain amount of peer pressure from being in a group, and often it's great because the group will participate. So not much from staff. I'm not directly involved in the student work. I think one of the things is for people to understand why it's so important to do this, and that's partly why we use the paper that we do with the quotes in, why we use the videos, because once you see this you begin to understand why it's so important, and that helps a lot, I think.
I think often the resistance comes with is this an actual real problem? But once people are on board with there really is an awarding gap and it really is a problem, and then they see that they can actually maybe do something about it as well, then people are on board. Please could you add a link to the paper, please? Yeah, Emily, I don't know if you've got Emily's ace at pasting things into chat, so I'll delegate that one to Emily. Are there any other questions or any other comments?
So I think we're probably about at the end of our allotted time slot, but please do feel free to get in contact if you'd like to follow up the conversation or find out any more. Our contact details are on the slides, but I'm sure your details could be passed on if you'd like to get in touch. Imogen.
Thanks, Catherine. I think if there are no other questions, then thank you very much for taking part.
Thank you very much. That was really interesting, really fascinating, a really important piece of work. So thank you so much to all of you for coming along and sharing that with us. You know, I'll just add my thing that I love the say my name thing. I think that's incredibly helpful, incredibly important to get names right. Amongst all the other things that were there, that's really important to cover. Thank you so much.